We're going to go to the front of the ankle bone here, which are the hip flexors, the muscles in the front of the hip. And I'm just going to use a nice gliding technique right around the bone there. Feeling the tissue, loosening it up. Again, one hand supporting, the other one's doing. And I'm just simply moving tissue around, loosening it up. That's where the body's innate intelligence comes in. It knows what to do. Loosen up the areas on the body simply by these techniques in reflexology. And then again, press and hold, and then you can even bring the foot into the thumb area. So I'm doing it's called a little torquing here. And then start back over here, behind the hip, the glute muscles. And again. And then you want to cover each space on the foot, each section, each inch. And in between this last toe here, the metatarsal, is the elbow area. Just refer to the chart. But pressing and holding. And again, go into relaxation so your hands don't get tired. Again, you want to repeat whatever you've done on one foot, you also want to do on the other.
Okay, so in this portion of the treatment, we're going to be working on the plantar side of the foot. And because I'm doing it, I'm going to come back to connecting to my client and just taking a few seconds and taking a deep breath and just being focused and connected for the time that I'm here. So we're going to be working on the plantar side of the foot, which is the bottom. And on the plantar, you're going to find pretty much all the major organs that you're going to work on. And you can keep your chart handy on the table. And you can always refer to the chart if you're wondering if there's a tender spot, what that is, what area of the foot that it is. So we're going to look at the foot as the body. And up here you're going to find the brain and the sinuses, the eyes, the ears. Over here we're going to have the lungs and the heart. And you want to remember that my right side is her left foot. And my left side is her right foot, so that you'll remember what side the organs are on. The liver is on the right side of the foot. The heart is mostly on the left. In the middle, we're going to find the digestive system. We're going to find the kidneys, the adrenal glands. We're going to find the colon. And then lower, we're going to find the large intestines and also sciatica. And a lot of lymphatics are also located on the bottom of the foot. So I'm going to just do some relaxing again so that, she feels that I'm relaxing her foot and connecting with her. And then I'm just going to start. I'm going to take my two thumbs and I'm just going to kind of walk her foot. And I'm just feeling. And I'm really focused about what I'm feeling on the bottom of her foot. And sometimes you'll feel like these little nubbies, or sometimes they call them crystals. And what we learned when I studied with Dr. Manzanares is they're called deposits. And we get into the certification program, we learn about what those deposits and how we can help people with those. So this area right here by the big toe is really important to work. And if you notice, I'm doing really good pressure. So it's a good hurt, because you want to create what's called an action potential so that all the messages get to the brain. So I'm going to work this particular area right here because this is really good for stress relief. So I'm going to do this a few times, and you can do any move you want, 3 times, 6 times, just whatever you do on one foot you want to do on the other.